I'm Lisa Carberg. Welcome to Medical Mondays, and we are talking about mental health during the holidays. It's a lot to deal with for some people. It can be a very tough time for as merry and jolly as it is for so many. We have Dr. Andre Newfield with us. He is the Regional Medical Director and Vice Chair of Psychiatry at St. Vincent's Medical Center. Doctor, welcome. Thanks for being with us.
Thanks so much, Lisa. Great to be with you.
Great to have you with us. So, such an important topic. A lot of people might not want to talk about these issues, but a lot of people are also feeling the pain and the stress of dealing with the holidays when it's not all merry and bright. Tell me the most common things that you help people with during these times.
So, around the holidays, we typically see a dip of patients coming in for services, but soon after the holidays, I guess a lot of depression catches up with people. There's a higher use of substance use usually around the holidays. People remember anniversaries and losses, particularly around the holidays. And it's a tough time in addition to the fact that there's less hours of sun, and that leads to natural depression in any case. So it's not easy for a lot of people.
So, what do people come to you, or is it mostly, I guess, losing a loved one and having the first holiday without them?
Yeah.
I'm seeing a couple of people go through that right now, and that is so hard. I'm 8 years from losing my dad, but boy, that first year is really tough. How do you help people?
So I think the main things is to keep in mind, to accept that it's going to be a little bit tough around the holidays sometimes. We also, we're always so eager for such a great time. And on social media, I think it gets idealized in a certain way. And then we're confronted with the realities of the situation that doesn't always live up to our idealized expectations. That can be tough. So I think setting expectations is really important to remember, okay, it's the holidays and there's going to be a lot of great things. But in addition to that, it's also going to have its tough times as well, especially if this is a first anniversary without a loved one.
What about being around loved ones? That can be stressful too. These people you only see once or twice a year. Families, you can't pick your family, you can pick your friends, and it's not always easy.
Yeah, that's certainly true. And it's a tough sort of double-edged sword because there is a lot of wonderful, great, joyous interaction. And then there's some times where it gets a little bit too much or it can be tough. And so I think building in some time with people, and if you're on a long weekend or if you're together for a full week, keeping in mind that building in some alone time is really, really important. Keeping in mind what are the stress relievers in your life, like exercise or certain rituals that you might have at home that when you're visiting elsewhere might be a little bit harder to incorporate, but you want to do all you can to maintain those sort of healthy outlets.
What about loneliness, doctor? We hear so much about it being an epidemic, and that makes me so sad to hear about that. A lot of elderly, but a lot of other people feel loneliness too, right?
Yeah, I think it's somewhat of an epidemic. I know that the Surgeon General over the last year or two certainly wrote about that. And I think when we have our homes that are full of joy, we want to keep in mind that there are people that are lonely. And so to keep in mind friends that you might want to invite over, or grandparents or elderly friends of grandparents can always be great. I think volunteering is a really great outlet, and going to a senior home and spending some time to spread some joy with them, and also talk about what might be difficult for this time of year for those individuals who might be struggling by themselves in those situations.
And there's a lot of things to be said for doing something good during the holidays. I've read stories that it boosts your mental abilities. And explain what that does to a person when you give back, when you volunteer, or just do a kind deed for a neighbor or a friend.
Well, we have these chemicals in our brain called endorphins, and they respond to all kinds of things like food and exercise, but certainly social interaction and that ability to give to people and connect with people and share joy and take somebody's burden can really release a lot of endorphins and make you feel really good. And I think particularly around the holidays where those themes are somewhat baked in and that can be really, really helpful.
What do you tell your patients that you see could be lonely or isolated? What kinds of activities do you recommend that they get out and do?
So I think it's avoiding some of the traps like, eating too much can be disruptive of people's sleep. Partying can be disruptive of people's sleep. So making sure that people, are trying to keep as much of a normal sleep-wake cycle as possible. Avoiding substance use or at least the excess of it is really helpful. And then doing the things like exercise that are healthy and baked in. I think trying not to do too much social media, trying to keep a sort of balance between virtual and real activities. Um, I think, shopping can be a big lure and um, gambling as well around the holidays. There's a lot of sports that are on TV, and so naturally, there's going to be more gambling. And I think trying to control those tough things that might be sometimes taken in excess is a healthy way to think about it.
All right. Dr. Andre Newfield, we are going to talk more about those topics and how they affect the brain in just a moment. Back with Medical Mondays, we are talking about holiday mental health and the stress it places on some people. Dr. Cheryl Valise is a psychiatrist with Hartford HeatlhCare, and she is here to give us her insight and wisdom on what she sees during the holiday. Doctor, thank you for being here. Tell us about some of the things you see as the days get shorter and it gets cold.
Hi, Lisa. Thank you so much for having me on. So, regarding the holidays, it can intensify both positive and negative emotions. People may feel a lot of pressure to be joyful, but many struggle with stress. There's financial pressures that arise, traveling, hosting, gift giving, loneliness, grief, missing loved ones during this time can be extremely painful, or experiencing some family tensions. During the holiday season, also sometimes we notice that use increases and can affect our mood. Disruptions to routines and less sunlight can also contribute to some of those changes in our moods as well.
So that's basically a Super Bowl of all negative things that could happen. All right, give us some thoughts on this. What do you tell people?
Um, in regards to coping with these kind of holiday stressors, typically I recommend to all of our patients, if they're able to maintain a basic routine, that can be very helpful. So consistent sleep times, wake times, avoid skipping meals, continue good exercise habits, or whatever, routines that we typically have. Setting realistic expectations and goals, especially regarding the holiday season. We want to be able to budget realistically, limit overcommitment, and not stretching ourselves too thin. With coping skills that I would sometimes suggest for our patients that are struggling during this time, sometimes I would talk about journaling, listening to positive music, utilizing some mindfulness techniques and grounding, and practicing gratitude as well.
What about loneliness? I guess what could advice do you give or what do you say about loneliness?
Regarding loneliness, especially during this time, it can be really difficult and challenging. Sometimes it's a reminder of people that are no longer in our lives, and that can be very painful. Celebrating people that were previously in our lives, that could be a good way to kind of honor their memory. Reaching out to our loved ones or friends, seeking connections can also be quite helpful as well. And just kind of getting out of our comfort zone a little bit sometimes, but again, not pushing ourselves too hard. But connections are quite important, especially during this time with our peers, our loved ones, and our family.
I like that, celebrating those that are not with us anymore. I think that's really nice to hear. We talked a little bit about the holidays. The first holiday without a parent or grandparent can be quite devastating.
Absolutely. And like I said, celebrating their memory and their honor, thinking about, happier times with them and celebrating their memory can be helpful.
And I always like to think of it as they would love that we're doing that.
Absolutely.
All right, you're a regional director of youth and adolescent mental health services. So tell me about young people. They have stresses just like adults, right?
Absolutely. During this time, kids are typically coming back to from school. They're on winter break, holiday break, so being home for an extended period of time without that structure of school can sometimes be challenging. We have noticed that at times, being away from their friends or, those structures and routines are hard, but making sure that our kids are getting good structure at home when they are home, back with us can be helpful. Sometimes with regards to changes with our children, we do notice that when it comes to mental health, if they are having some difficulties as far as low mood. Sometimes we might notice that children are oversleeping or expressing or showing increased fatigue. Sometimes they might have some changes in their appetite. These are some of the things that we might notice as far as, changes in their moods when they're coming back home during the holidays.
And when you do see those changes in adolescents or teens, what should you do? When do you intervene?
Definitely checking in with them can be very helpful. Acknowledge your feelings, just letting them know that, you've noticed some changes, to just check in gently is what I would recommend. Ask people how they are holding up, if there's anything that they need. Reducing a little bit of pressure can also be helpful at times. If they seem a little bit overwhelmed, allow them to skip a couple of events here and there, but offer alternatives that might be easier for them to accommodate with. So, for example, maybe having coffee, tea, taking a walk together, a quiet movie night, encouraging some healthy habits, helping them stick to routines, and encouraging professional help when those are needed.
And doctor, let's talk about when it's time to get help. How do you know and how do you reach out? Who do you reach out to? Can you get help on your phone? I've touched on this a little bit since COVID. People feel a little bit more comfortable maybe doing virtual, but when do you know when it's time to reach out and get help for issues?
So I think some of the red flags that I would definitely like to mention or bring up are expressed thoughts of suicide. If if the people that we love, they're having an inability to care for basic needs, or if they're just displaying severe withdrawal and social isolation, symptoms of psychosis or increased substance use, or if they're also expressing thoughts of self-harm to themselves or others. If this is the case, it's important to get urgent help. So calling 988, 911, contacting crisis lines, or bringing them to emergency services in this moment would be ideal.
And we're almost out of time, but sadly, do suicides go up around this time of the year?
We do see an uptick at this time, especially because there are a lot of stressors. So if we're able to find these or notice these red flags, bring attention to them, and get them services immediately, we can do what we can to reduce those.
All right, Dr. Cheryl Valise, thank you so much for your time and expertise. We really appreciate it.
You're welcome. Thank you for having me.
All right, we are back with Dr. Andre Newfield. He is the Regional Medical Director and Vice Chair of Psychiatry at St. Vincent's Medical Center, which is part of Hartford HeatlhCare. Doctor, thank you for being with us. So you are an expert on all things psychiatry. Let's talk about, you mentioned exercise. We're in this stressful time of the year with the holidays. Expectations are high. Reality can be low. It's a lot for all of us. I mean, it's, as I said, it's wonderful and joyous, and whatever your traditions are. It can be beautiful with the lights. Let's talk about the benefits of exercise. What does exercise do that is so positive for your brain and your body?
Well, I think it helps set a healthy sleep-wake cycle. It's certainly for your cardiovascular health in the long run really helpful. But I think on a short-term basis, especially sports or exercise where you can partake with other people, then there's a social component which is really helpful. I think also setting healthy boundaries about it, not over exercising, not having too great expectations or being disappointed if you don't set high marks, just going out for a nice walk, even if it's not the most brisk walk, just getting out and doing something to get the blood flowing a little bit better is really, really helpful. And it helps in digestion, it helps with sleep. And in the long run, it certainly has benefits in weight control, cardiovascular breathing, and all kinds of other health benefits.
What about brain? What does it do to the brain? I always feel better after I take a walk or do something active.
Well, as we discussed before with endorphins, it certainly helps to release those chemicals that help people feel good. And people talk about sort of that artificial high that comes along with exercise. I've certainly experienced that myself. And so that might be what people are feeling sometimes. I certainly feel better when I'm, doing something with somebody else than sort of an isolated exercise. Certainly that social component can help as well.
And you don't have to go out and walk for miles and miles. We've had a lot of studies where even just a little is good. Just getting out there, putting on your sneakers, lacing them up, and get moving.
Yeah, 10 to 15 minutes a day, especially after, a big meal. I know that a lot of people around our hospital have started to do walks on their breaks. So 10 or 15 minutes around the parking lot or, wherever you can find a safe way to do that is really helpful and helps people focus better once they get back from their break and their walk.
All right, Doctor, let's talk more about social media. You had mentioned trying to not do as much of it to add to the stress of the holidays. What does social media do to our brains? We're seeing more and more studies. We love it, we consume it. A lot of apps out there are very popular. But what are you seeing?
Well, apps are sort of monetized to compete for people's attention. And so they sort of suck us in. And I think most people probably have experienced those moments when they've logged on for one simple question and then they've gone down a rabbit hole and there you are an hour and a half later and you don't know where the time went. So certainly your attention and time get diverted pretty easily. There's a new study out that talks about the effects on teenagers and how it can be disruptive of sleep and overall is associated with a lot of other um, health concerns. And so it's early on, and studies are assuredly going to be emerging to back up what at this point is the anecdotal evidence that there are concerns about too much social media. But for right now, I think we're seeing early indications that we want to try to limit, especially early age brains, from using too much social media or spending too much time online.
All right. And, Doctor, what about seasonal affective disorder? We touched on it a little bit. It's different than depression, correct?
It's actually something that can lead to depression, and many things can. But this is when there's less hours of light, and our brains make certain chemicals based upon how much light we're experiencing around us, and so that it isn't uncommon for people during these darker days of the season or year to start to feel a little bit more down exclusive of the holidays, and that might be because of the time change and there being less hours of light. And so, certainly, if you start seeing that your sleep is off, or your appetite is off, or your ability to get out of bed or function, your energy levels, your concentration, just your overall mood is down. That's not uncommon, and seeing a health professional is really important. A general practitioner can be helpful, but if it goes further and you want to see a mental health expert, then seeking out a therapist or a psychiatrist could be helpful. There are things like light therapy that can help make up for the light deficit and actually are shown to help people with depression for
I've
those that are
seen some
suffering
great
from.
results from light therapy from patients. Just sitting
Yeah,
in
it's
front of
really
a
easy.
light for a few minutes a day.
Yeah,
Tell
yeah.
us about, we have about 2 more minutes, other treatments for seasonal affective disorder.
Well, if light therapy isn't effective or for whatever reason that isn't available, then certainly some antidepressants might be helpful. Along with depression, certain crossover symptoms certainly mirror anxiety, and oftentimes depression and anxiety go together. And so talking to a therapist about different strategies to curb people's anxiety can be very helpful as well. And some of the same medications that treat depression also treat anxiety.
And doctor, 1 more minute left, but getting help has never been easier. I feel like COVID, we went to our phones for medical care, and the stigma of not having to go into an office. Is that correct?
So I think, one of the silver linings about COVID, it certainly probably led a lot more people to be depressed since they were more isolated on average, but it helped people sort of feel a little bit more normalized experiencing or talking about mental health issues. And I think it helped people realize the availability. I think there's always going to be a barrier to getting treatment. And so, talking to your relatives, you never know who else might be suffering from the same issues, and they might have advice on how to get help. Seeing your general practitioner, or if you have a therapist, opening up about what you're experiencing, or other people in your life that you might be worried about.
All right, Dr. Andre Newfield with St. Vincent's Medical Center, thank you for all of this great advice. We appreciate your insight.
Thanks so much, Lisa. Pleasure to be with you.